And I think I'll start by just telling you just a little tiny bit about me. I don't want to bore you about me, but I'm a retired NHS laboratory scientist, and I've worked did work in haematology for about 40 odd years, and part of my role was haematology oncology and looking after the clinical trials that the department undertook. So I joined HealthUnlocked, the CLL support group, after I'd had my diagnosis for about 4 years. And really, I only went in to have a little mooch about and see what was going on. And I thought, oh, that's quite interesting. Oh, good. I'm glad they know about that, and this and that and the other. I started posting a few little things. And after a relatively short time, I was asked to join the admin team. So that's a little bit about me and everything else. So why are these online communities a good idea? Well, we know that when you get your diagnosis, it's a very scary and lonely time. Even if you've got the best family around you, you can feel very alone, and sometimes you don't want to express all that worry and anxiety to them because you don't want them to feel worse either. So this is very much a sort of a safe haven, and communities like HealthUnlocked are helping people to come together and cope with complex illnesses, chronic illnesses such as CLL. They offer important aspects of support that can help people with their general feeling of well-being and not alone. They feel as though somebody's been here, somebody else has coped, somebody else has come through it, and somebody else has reached whatever point it is. So the HealthUnlocked forum is very much a place for shared experiences, okay? And through those shared experiences, knowledge and information about their condition, hospitals, healthcare services and drugs, we feel that that's leading to improvements in patient care because those patients are becoming informed, and when they're informed, they're having a better dialogue with their doctors, and that's then becoming more of a partnership approach to their care. And that makes people feel safer, more in control, and less lost. And I don't think you can underestimate the value of that. So a little bit about HealthUnlocked. Moving away, aren't I? Hello. I keep looking at the screen. I don't know why I've got it in front of me. Oh, right. Oh, have I? Okay. Oh, right. So a little bit about HealthUnlocked. It's not like Facebook. It's not like Twitter. It's a dedicated health platform. And it's been set up by doctors. Okay? It's a safe, anonymous place to express worry, get information, and seek advice. There are currently more than 700, and that's a lot, isn't it? 700. You wouldn't think there were 700 different conditions that people wanted support for, but there is. And it's on the most massive range of health conditions, so PTSD, bad backs, fibromyalgia, and our baby, CLL. These communities are often in partnership with the charities. So the CLL support and leukemia care each have a presence on HealthUnlocked. And they are different, but doing similar things. Leukemia care also focuses on acute leukemias, whereas CLL support that's its only focus. And of course, we've got global reach and participation. Anybody in the world can find that forum and ask for advice and support, and they do. So this is me. So the first thing you have to do is to join HealthUnlocked. I'll just sort of go through a little bit about how you sort of set it up. And set up a profile. This just happens to be me. All this information I've posted here is not compulsory at all. You can say absolutely nothing if you don't want to. But it is helpful if people complete the information as much as they want to disclose, because if they're asking you a question or they're looking for help or support, that background information can provide a bit of guidance for you about where they're, what's been going on, and make your advice, I use that term very loosely, more tailored to their situation. There's also a back page to that, which you can't see here, which has got things like your date of birth and various other different contact details that is kept extremely private, and you can choose to disclose however much you want to. So this is what the CLL Support Association front page looks like. And there's just, I'm sorry I can't get more on really, but there's a string of posts. If you're on this page, it's the most recent post. If you happen to click on the home page, as many people do, it will show you the most recently answered posts. So you have to join first, and then you join the community. So you can be a member of several different communities, and lots of people are. This is the leukemia care one, just for Nick to show I'm not ignoring him. But you'll see each group has its own banner and profile, its own polls, pinned posts, and relevant information. So, being an administrator, I can't emphasise how important it is to have some guidelines about what people can post and what they can't post. Because otherwise you will get people who will say and do inappropriate things. And if you've not got any guidelines, really it's very difficult then to moderate it and guide people and keep it focused. You need a team of people to look after a site like this, because for the CLL support site, we have over 13,000 members, and we probably have about 20 posts, questions a day. So it's a busy, busy, busy site. And our moderators or our admin team, there's only a small number of us, and that's good and bad. Good because we each know what the other will be thinking and doing, mostly. But bad in there, it presents, a bit of a burden to you sometimes. But we have got these moderators across the globe. So there's somebody in Australia, there are people in America, there are people in the UK and Europe. So, as I've said here, moderators can edit and delete posts. That is true, but in our group, it's only the admin team that can edit and delete posts. And we do. We absolutely do. We make no bones about it. If your post is inappropriate, we will, because we want to keep that site a safe, welcoming, information that is rigorously referenced place to be. We want people to come and know that what they're looking at and what they're reading is right, and that they feel safe in the knowledge of that. So, as an admin or a sort of moderator, the idea is really just to do that. Don't answer every post, because if you dominate by answering, it deters other people from responding. And actually on the CLL site now, we have a huge number of people who are genuinely really well informed. And that is fantastic. Each of these people, in their own way and as much as they want to, are becoming their own expert in their own version of CLL, because everybody's version of CLL is uniquely different to them, isn't it? It can be very time consuming, as you said. We don't have schedules and things. Wish I'd thought of that. But we don't have schedules, and we don't have regular posts, really. We have pinned posts, which are answering the sort of questions that come up regularly, like, what do my markers mean, maybe? How can I get some travel insurance? What vaccinations should I be getting? And things like that. So both the group can be busy. on top of that, people sometimes send you personal messages. Now, that might be from within the admin team, so it's a sort of team support thing, and we'll be saying, what do you think about that post? So, not really sure about that bit, don't like that bit, speak to them about that. So all those little personal messages are going on in the background. Dealing with problems, so if somebody's put something that's inappropriate, or somebody's said something, I'm not really sure about that, so you've got to go away and check it for yourself. So you do need to sort of try not to let it take over your life. And when I say inappropriate messages, they can be unkind, or inappropriate, or they might even be deterring people from getting some treatment, because believe it or not, like the anti-vaxxers, there's a lot of alternative people out there who like to join and let you know, give you their advice. So in terms of good practice in moderating a site, keep the group focused on the condition. Don't let it become just another social forum. We're there, really, or at least our raison d'etre is there to provide support, information, reports on meetings, and things like that. And that, I said we don't have a schedule. As and when research papers are published, we will be on it, and we will be posting those on the site. As if ASH is currently on, then we will be subscribing to the news feeds, we'll be getting that information, we'll be posting the videos, posting the reports and everything else. So it's literally, if there's a lot going on, there's a lot on the site. If there's not a lot going on, it's a quietish time, then it'll be whatever's in the journals and happening to be published, as whatever we can get that's not behind a paywall, essentially. So keeping up to date with treatments, research developments and things like that actually brings people to the site. If they Google stuff, whatever, then there's a good chance that HealthUnlocked, the CLL support, will get a hit. I'll come on to something, locked and unlocked posts in a moment, but that regular flow of new information about new treatments, research, information, and just being kind to each other keeps people there and also brings new people in. We were getting something like 200 new members a month at one time, which is just a phenomenal rate of increase. There was another group called CLL America Power, or CLL Patient Power America or something, but that has folded now. I don't have any moderators for it, and the HealthUnlocked team have actually put a notice on saying please go to the CLL support site.
I think so, if I can just
Yeah.
add something there.
Yeah.
We've made a somewhat conscious decision. We set up a page on HealthUnlocked, a CLL learning page.
Yeah.
And to not progress with it, because they're doing such a good job.
Oh, bless you.
There's no point, as I said, I don't know if you were here, to reinvent the wheel.
No.
There's a very, very good forum there, and so I think our responsibility is to encourage members who do want to talk in a private space and not in a public forum on Facebook to go to HealthUnlocked, to that.
To signpost,
Because
yeah.
I know it started off being CLLSA UK, but
It's a massive globe. We have honestly members from almost every corner of the world except China, of course, because they can't get in.
From an identity point of view, there's probably a central place there for you to think about a branding exercise around it, because I don't see it being CLL.
Well, it is a global thing, but the CLL, it is hosted. In fact, it's effectively the overarching body is the CLL Support Association, which is based in the UK. So that's our anchor, if you like, and those are the people that provide our umbrella and that we work with. What was I going to say? So you need to grow a team of moderators with different strengths. And we don't have a big team, as I said. That is helpful because we don't have to deal with lots of people when we're sort of chatting in the background about different things. But we've all got different strengths. So we've got somebody who is a retired GP. We've got somebody who's a retired nurse. We've got somebody who's a social worker who is absolutely fabulous at the touchy-feely stuff. You know, reading that post, and actually it's not that question they're asking, they're just really worried. Somebody to put some balm on it and say, you know, we're here, we're listening, and, you know, lots of people here have been through that, and I'm sure some other people will, you know, will provide their experiences. And then there's me, to do a bit of the sciencey stuff and things like that. So HealthUnlocked has some, what are you laughing at, Nickers? So, as I say, clear guidelines, really important. New members welcomed, directed to the pin posts and also to the posting guidelines. So right from the very beginning, we're saying this is our standards, this is what we expect and things like that. Read the posts carefully. This is what I was saying. They're not always what they first seem. Close posts to stop inappropriate response. We get a number of health surfers, and I don't know if other people get that, but they might have been to the doctor, had a blood test, and the lymphocyte count might be a little bit high. Dr. Google will throw up the HealthUnlocked, they join, and then they post saying, my lymphocyte count is 6.9. And my platelets are 150, you know, what am I going to... And then some people, perhaps members who are a little bit inexperienced or just somebody well-meaning will say, oh, that's a fantastic count, you know, They'll assume that they've got CLL. So somebody who's a little bit more savvy and perhaps has read the profile at the back and might not be anything, will say, do you have CLL? Oh, no, they don't. Okay. So we just try and reassure them a bit, you know, go back to your doctor, and then we'll close the post just to stop them getting advice like go and see a specialist, you know, get the fish tested done and all the rest of it. That really isn't what, that's just going to scare people obviously even more. We don't give medical advice. That is really important. We can signpost, we can provide information, we can say, you know, have you asked your doctor about this or that, but we don't give medical advice. We will often say, please go and see a CLL specialist. People in America in particular are often seen by a general oncologist, and as soon as their white count gets to 150 or their liver count gets to 150, they want to start treating them. And so we'll send them a copy of the treatment guidelines from the IWCLL, and then basically it's for them, if they want to read it and then go away and have a discussion with their doctor about it, you know, do we really think this is still right? Sometimes people post very personal things and personal photographs. And there are two sorts of posts on HealthUnlocked. There are locked posts, which means that that information and that post and all the responses can only be seen in that environment, only if you're a member and only if you're logged in. There are also unlocked posts, which can be found on a Google search. So we don't want those sort of things to be visible outside the community. So one of the admin team will just go in and lock the post so that it's safe for people, because we take the online security extremely seriously. Pitfalls. Oh, it can take over your life if you let it. That's why you need a team. You need a good team, nice people. I've already spoke a little bit about safety and security and locked and unlocked posts and the reason for it. A lot of the posts are locked. I would say that probably 3/4 of the posts are locked. I will quite often put up posts about new treatments or clinical trials or research and stuff like that. And those posts are not locked because that actually brings people to the site. And there's nothing there that if you looked hard enough on the internet or if you knew what you were looking for on the internet that you couldn't find anyway. So, so the locked and unlocked posts are important. Spammers and bad people. Have you had any from yours? No.
We've had a couple of tweeters that we've had to unfollow.
Yeah. So spammers will join, scammers will join, and they're all the same sort of people. They join lots of groups, then they start following lots and lots of people, because if you're interested in somebody, you can follow them so that every time they post something, you get an email alert. They're not following them for that reason. They might be following them so they can send them a message, and they're essentially flogging something or trying to entice you down some sort of green kale smoothie route or something like that, that's obviously going to cure you. Sometimes people aren't what they first appear to be. Some have mixed motives and have their own agendas, and some are just flipping difficult, obnoxious people. They just are unkind. Or they just don't know how to phrase it. I mean, you're nodding in agreement. It is true, isn't it? They're just... But having said that, I think in the 3 years or so that I've been involved in this group, we have only restricted 3 people. And restriction means that they can't post anything, so no more nasty replies, but they can still read and get the benefit of being on the site. If they're really awful, and I think we had one person who was really, really awful and abusive on the public forum, then HealthUnlocked will ban them if we ask them to. And they can't join any community then, so it is quite a drastic step, you know. We already spoke about the health surface and the worried well. Yeah, because you see the same people week after week, and they might be answering questions that other people have, you know, with their own experiences, or just being nice, you know, wow, that's fantastic, great to hear you got through your treatment, and things like that. You actually do start to care about these people, and we can get too involved with people's struggles. Sometimes, certainly in the background chat, we'll say, has anybody heard from so-and-so, so-and-so? You know, she'd had a Richter's transformation, we haven't heard anything since, oh dear. And people will die. It's not easy, they disappear, and we hope that they're treated and are having a remission and it's a lovely life and they don't need to be there, because people do tend to come when they're at some sort of milestone, don't they, their first diagnosis, or maybe when they're approaching treatment, or they're, you know, those sort of times. So we hope that they're having a great life, but sadly, you know, some people die. I missed one. Okay. One missing, but it doesn't matter. We'll move on. So, you've probably heard this before. Tips for keep the forum a safe and welcoming place. People don't want to come on if they think they're going to get attacked or ridiculed or belittled or anything like that. They want to feel they can say what they need to say without anybody, you know, being unkind to them. Ban the spammers. Oh, yeah. Some of the alternative medicine people, you can't reason with them. They're like the anti-vaxxers, and there is nothing you can say that will change their mind, and they are off the site because they're dangerous people to have there, because they stop people, you know, people can go down that route instead of going, you know, the appropriate treatment route. Monitor the site regularly, look out for problems. Watch out for posts and comments that break the guidelines, and then have a word with people. You might need to delete something or whatever, but have a word with that person. A lot of people go, oh, I'm sorry, forgot, doesn't matter, I won't do it. You know, they're really, really fine. And as I said before, about posting regular updates on treatment, because that will keep people on the site and keep people coming back to the site. Okay. So if there's difficulty with a member, we talk about it in the background, okay? Members are looking for different things at different times. You have to try and be a bit intuitive about what they're asking for. Read the post carefully, make suggestions, look out for unanswered posts. So in conclusion, got a slide missing. Online support groups offer a really important support system for patients and for carers. We have a lot of carers who are there as well. A team of moderators with different skill sets and knowledge bases is really important, spread across the globe in our case. Have the posting guidelines, focus on CLL, and try to ensure that posts are answered in a timely way, so within quite a short period of time. And just to be part of a group like this is extremely rewarding, to feel as though you might have made a difference, signposted someone in a different direction for something that you knew probably wasn't appropriate is very satisfying. Nick tells me to shut up, so that's it. I hope it wasn't too much of what you've heard before. Has anybody got any